We believe that Northwest Arkansas and the state of Arkansas is the perfect laboratory for creating a new model of healthcare.
When we talk about value-based care, the low-hanging fruit of value-based care is integrating healthy behaviors into health delivery and medical care.
I believe that we at Stanford, we have so much to learn from our friends and colleagues here in Northwest Arkansas, being unified in our goal to see us bring our talents from all sources to bear on the problems of the Heartland and then beyond. That should really be a unifying goal for our country.
Our rural health issues are a big problem. And if we don't intentionally look at how to improve health for our rural communities, it's not going to change. Our mission is very focused on Alice's vision of bringing in medical students that are from a rural background to work in a rural area. And how do we put technology with that?
Progress on AI is great, but if it does not actually provide equity, then you've got to ask if the promise has been fulfilled. If we only rely on technology, we will see a leap, but we won't solve the equity issue and we won't solve fully the outcome issue. And I think that requires redesigning the way we actually approach healthcare and rethinking medical education.
It's really taken to now, and the incremental changes in AI and technology that can allow us to create a new, lower cost, higher quality, more accessible healthcare system for all. So thank you.